The new ear popper from Micromedics is a non-surgical, non-drug-related medical device for treating some of the most common ear problems in both children and adults. Some of the most common conditions treated would be otitis media with effusion, eustachian tube dysfunction, and problems related to negative middle ear pressure, such as descending in an airplane or scuba diving. The treatment is as quick as a swallow. The ear popper delivers a constant flow of air into the nose. The patient swallows while the device is running. During the swallow, the air is diverted up the eustachian tube, clearing and ventilating the middle ear. Treatment begins in the doctor's office. If the condition warrants continued use, then the doctor would prescribe a home unit for the patient to use according to the recommended treatment guidelines. The new ear popper from Micromedics. Safe, simple, superior results. These are the steps for using the ear popper correctly. The following has been slowed down for instructional purposes. The actual treatment only takes a few seconds. Begin by placing the nose piece against one nostril. Remember that creating a tight seal is crucial. Plug your other nostril closed tightly. Push the button to begin the airflow and swallow while the device is running. Then repeat this process for the other nostril. To help facilitate swallowing, you can take a sip of water and hold it in your mouth. This is recommended for children and also for adults that may have trouble swallowing on demand. The keys to a successful treatment are creating a good seal between the nostril and the nose piece, plugging the other nostril closed tightly. Remember to keep your mouth closed and make sure you swallow while the device is running. It's important to remember that the treatment only occurs during the swallow. A patient will know if the ear popper treatment was successful in one of two ways. Some people will feel the air opening their eustachian tube, which is commonly referred to as a popping sensation. The experience is similar to when you feel your ears opening or clearing when landing in an airplane. This familiar popping of the ears is caused by the opening of the eustachian tube during swallowing. This is nature's own way of relieving pressure imbalance in the middle ear. The sensation of the ear popping during the ear popper treatment is important because it indicates the treatment is working. The popping sensation can range from practically no sensation at all to a momentary feeling of pressure. The ear popper is equipped with two different settings to accommodate different tolerances of this sensation. Other patients may not feel a popping sensation. Instead, they may have a feeling of fullness in their ears after using the ear popper. This is also another indication that the air was successfully diverted up the eustachian tube. There are two feedback mechanisms that help ensure a successful treatment when administering the treatment to others. The first feedback mechanism is an audible pitch change in the motor. You can demonstrate the sound yourself by plugging the hole of the nose piece with your finger while the device is running. During the swallow, the ear popper motor will slow down, creating a change in pitch. This sound indicates that the patient has swallowed and that the air has been diverted up the eustachian tube. The second feedback element is visual feedback. The second feedback element is noticeable in most patients, but not everyone. In most patients, you will see their nostril bulge out during the swallow. This will also indicate the patient has swallowed successfully and the air has been diverted up the eustachian tube. By following these steps, you are now ready to begin using your ear popper device. Remember to contact your doctor before beginning any treatment with the ear popper. And thank you for your support.